Hi everyone, it's great to see everyone joining. Welcome to today's webinar for the Nursing Now Challenge, looking towards the future of nursing and midwifery leadership. We have some great speakers here today joining us. So my name's Alice, I'll be taking us through the webinar today. I'm an early careers nurse in Scotland, and I had the pleasure of working with the Nursing Now campaign on the final report, and had quite a lot to do with everyone that's here today. So if you could just say hi, introduce yourselves in the chat box, that would be great. And as we go through, you can put questions into the Q&A box and we can answer some of them towards the end. But first off, we've got Shirley Baines, who's the CEO for the Burdett Trust of Nursing, who's going to say a few words.
Hello, thank you to everyone joining this webinar today. We are all excited by this programme, which is continuing as the Nursing Now Challenge. Let me now explain a little about the Burdett Trust for Nursing, for those of you who don't know. The Burdett Trust, since the beginning in 2002, has supported nurse-led projects. It uses its funds to empower nurses and make significant improvements to the patient care environment. Since 2002, Burdett has awarded grants totaling just under £50 million, an amazing amount of money for nurse-led projects. The trustees target their grants at projects that are nurse-led and focus on supporting the nursing contribution to healthcare. The three key areas are building nursing research capacity, building nurse leadership capacity, and supporting local nurse-led initiatives. The Nursing Now Challenge fits nicely within the second category, building nurse leadership capacity. So from the beginning of the Nursing Now campaign in 2018, the Burdett Trust has supported this movement to unite nurses, health advocates and allies from around the world in the first ever global movement to champion the role of nurses. Nurses are born innovators. Of all clinical groups, nurses, midwives and allied health professionals work closely with the largest number of patients at every point of the care journey. This contact gives them a unique understanding of how to make a positive impact to patient care. And we have seen over the last year truly inspiring work from nurses everywhere working in extremely difficult conditions. The Burdett Trust is proud to support the Nightingale Challenge since its launch and will continue to support the leadership development of nurses and midwives around the world through the Nursing Now Challenge. The programme focuses on leadership and will help nurses to innovate and flourish. The Burdett Trust is proud to be supporting this important initiative and to improve health globally by empowering the nursing workforce. The Nursing Now Challenge will accelerate the early career nursing leadership agenda by working with health employers around the world to create development opportunities and positive practice environments in which the skill of early career nurses can be harnessed and used to its full potential. The Burdett Trust is committed to improving health globally, and we believe that the way to do this is by supporting and empowering the nursing workforce. I have been delighted with the success of the Nightingale Challenge in spite of the challenges of the COVID-19 pandemic, and I am looking forward to this next chapter as we build this global momentum and commitment to nursing. Thank you.
Thank you, Shirley. Next up, we have Lisa Bayliss-Pratt, who is going to speak on why you should take up the Nursing Now Challenge and what we can offer. Lisa is the Programme Director, and she's going to speak to us now.
Thank you so much, Alice, and thanks so much, Shirley, for your wonderful speech and the support that we have from the Burdett Trust for Nursing. It means so much to us all, I'm absolutely sure. And that figure, 50 million, is quite eye-watering, actually, since 2002. So it's good to see that we do have a fantastic investor that believes in us and has done for so many years, which I guess is at the heart of what the Nursing Now Challenge is striving to do as we progress into this next phase of our exciting journey together. So just a little bit about the Nursing Now Challenge. On June the 1st this year, we progressed from the Nightingale Challenge, which, as many of you will know, was all around the 3-year global movement of Nursing Now, the social movement that was due to finish in 2020, but because of COVID was extended an extra 6 months. And part of that work was really to put the spotlight on what early career nurses and midwives could achieve as part of this really exciting movement. And it's been an absolute privilege to be part of this and to learn and engage with early career nurses and midwives all over the world that are making a massive difference. And I think COVID has really demonstrated that in buckets full. And it was a real delight when we got the opportunity to continue the Nightingale Challenge and to continue this spotlight on early career nurses and midwives and supporting their capacity and capability, bringing them confidence, providing mentorship opportunities, and really enabling the world to see just how powerful this group of individuals are if they're supported, nurtured, and invested in. So from June the 1st, we've got a fantastic mission to not only build on the over 30,000 that we managed to recruit in spite of a pandemic, but to get to 100,000 in more than 150 countries by the end of 2022. So lots of ambition there, but I believe it's totally achievable with the support that we've got and the work that early career nurses and midwives achieve day in, day out in so many different countries. And we're really all about maintaining the fantastic work of the overall 3-year social movement of the Nursing Now campaign, which is about continuing to raise the profile, the power and potential of this brilliant workforce. We're really keen that we continue to engage employers, universities and colleges. And although individuals are really keen to put themselves forward, we want them to do that through their employers or through their universities, and because that really shows that value and that joint investment that's being made in these individuals. And excitingly, what we've learned over the time is that we can create a fantastic global network that empowers each other, that supports each other, and development of positive practice environments. And one of the areas that's such a pleasure for me as a nurse with over 20 odd years of experience is the learning, the development and the positive culture that we can create by coming together for an hour or two once a month or a bit more often to talk about contemporary issues that we face in nursing and midwifery practice. We're really keen to make sure as well that early career nurses and midwives are seen as the leaders of the future, and that we're not just there to be, we're of course there to be delivering patient care and working with communities, but we're there to lead that health agenda. We're there to support decision makers in making the right decisions so that the investment is pledged and that individuals are supported. So it's so important that this isn't just about doing a leadership course. It's about really building that capacity and capability, helping people to influence, make connections with decision makers and have a go. I mean, one of the things that Lord Crisp, said, who was the architect of all of this, was that it's really important for early career nurses and midwives to be given the opportunity to have a go. And if it doesn't work, well, there's more opportunities that can come along later down the line. But once you get perhaps a little bit more mature in your career and things get more risky, we become more risk averse. So we've got these fantastic agents of change in front of us that we need to empower and support to be the best they possibly can. And I'm so excited that we've now opened up the initiative to student nurses all over the world. And I think they're going to bring an added dynamic to this, which we will all benefit from. And we never must forget that we're here to do this, not for ourselves or for each other. That's all very nice. And we need to support each other. But this is about getting more health to more people. And the only way we know we're going to do that is by investment in the nursing and midwifery workforce. And we need to really promote some fantastic work that's gone over many years, such as nurse-led clinics, specialist nurses that deliver amazingly complicated care in a seamless, holistic, person-centered way, developing midwifery services and pathways for early career, for early years and women's health. We know that nurses and midwives are very, very much trusted in their community. So how can they really influence the primary healthcare environment? So these are some examples that we need to really push and promote. And there's many countries with some brilliant ways in doing this, and we need to harness that and make sure we share that learning so that we can each really develop in these areas. And some of the success of the Nightingale Challenge has been phenomenal, really. And, it's touched people in so many different ways. So we've had quotes and feedback from very senior leaders that have said, why has it taken me this long to find the early career nurses and midwives in my organisation and feel that I can actually engage with them and that they can engage with me? Because we do know, whether we like it or not, that in many countries, nursing and midwifery can be hierarchical, and as a result, it's very different for an early career nurse to speak to a very senior member of the organisation. But through the Nightingale Challenge, we've been pushing our early career nurses to spend time with the decision makers in their organisations. If they've got boards and decision making fora, go and sit and be part of that. And there's absolutely been a groundswell of mutual benefit by everybody listening to each other and really thinking about this cadre of early career nurses and midwives, that yes, they need support, and yes, they need a brilliant preceptorship, but they also need to be given opportunities to take risks, and they need to be taken seriously. And that's what this initiative has really unleashed, which is more, I think, than we could ever have dreamed of when we first set out. And here's some of the latest figures. And I'm just so delighted to say, when we did this webinar, I think it was about a month ago now, we were just under 32,000. Look where we are now, over 33,000, nearly actually at a 34,000 there. And this just shows within the time that we've been engaging and promoting, and we often work through really influential senior nurse midwifery leaders, educators and decision makers that we've got right behind us on this initiative. And it would not have been possible without those people. But through this collective will and this desire to really put the spotlight on the power and potential of early career nurses and midwives, the numbers are starting to grow. So we've only just started. Watch this space is what I would say. But you can see within the WHO regions, there is differential levels of numbers and differential levels of engagement. And some of the work that we want to do is really understand, why is that? Why have some countries taken this work on more than others? How can we network with some of our partners, with some of our collaborators, to really grow the numbers in some of the areas where we haven't done so well? So anybody that wants to be part of that journey, please do let us know, because this is really about sharing, engaging, and providing that opportunity to reach as many people as we possibly can all over the world. Thank you. Next slide, please. I've talked a little bit about what we've learned so far, but just a few points here. It has been a catalyst for change for early career nurses and midwives, and it's not for me to tell that story. You can listen to the people themselves, and Alice here today, chairing and leading a global webinar. There's no shortages of Alice's. I mean, Alice is unique and brings unique characteristics, but there are many early career nurses and midwives out there that are just really excited to step up to challenges, to be given the opportunity. They can lead, they're educated brilliantly. So let's use that education and give them those opportunities to really shine. And that's been really key to this. We also know that these opportunities just provide that safe space to engage, to share, and to inspire each other. And certainly through some of the dark days of COVID, and all of us have no doubt had them in different ways, in different times, in different countries. But whenever we've brought people together to talk about a topic around professional practice in nursing and midwifery, we've never ceased to be amazed at the people that have signed up, the inspiration, the engagement, and the follow-up that's happened after that. So we're here to support each other, and I think that's hugely powerful in itself, and it demonstrates that just by us investing together for small amounts of time, we can feel better about what we do. It might keep us doing the work that we know we can do so well, and we're role modeling to other people, which is so very important. So long may this continue. And sort of in terms of what the Nursing Now Challenge can do for you, as one could put it, is this is an exclusive social platform that will allow you to connect and collaborate with other nurses and midwives all over the world. And that's very exciting to be able to pick up your phone or pick up your Facebook, however you do this, go on to Twitter and have a conversation about what's going on the other side of the world. We've also got some really exciting partnerships that we're brewing. One at the moment is with Health Education England, another is with the Tropical Health and Education Trust, and we've also got JPIGO colleagues that we're currently working on cooking up a plan, and Pandora's smiling at me because we're just working through some of the bureaucracy to try and get to that. But we're all about partnership and collaboration. We want to work through and with other people because I believe that's the way we'll get the greatest reach possible. And we want to see ourselves as a growing global movement and something to be admired, to be engaged with, and perhaps a force even to be reckoned with in a few years' time when we've done more work and we've grown ourselves as this really exciting network. Inevitably then comes really good opportunities to share online resources. We at the Coventry University, where this programme is hosted, we've got world-renowned education that we can provide that's free of charge. And we really want to be able to support people in many different ways at very low or no cost to be able to develop their skills, their development, build up their CV and build that confidence to be able to go for that next job, to be able to knock on the door to that really important decision maker and say, this is what we need to do, back me. And that's exactly what we're striving to achieve. Thank you. And then another exciting area is the Global Solutions Initiative. And this has been something that's a really exciting plan that was hatched by the wonderful Hannah Finch that does a lot of she's our communications director for the Nursing Now Challenge. But she said about 18 months ago, I think we need to do more than just build this network. Why don't we throw a challenge out and see what comes back? And so due to her brilliant communication skills and her leadership, we've had a number of global solution initiatives that have really provided exciting insight into how early career nurses and midwives go about making change. We've been able to partner with some super organisations such as Nourish, Same You, Jaya and Salus, and long may this work continue, because this again demonstrates really tangibly the difference that early career nurses and midwives make when you throw out a challenge and say, go on then, tell us how you can make things better in this space. And in return, people have received mentorship from people like Lord Crisp, from the chief executive of Same You, which is a charity. And it's been a wonderful opportunity again for very different people to provide different insights into each other's world, all for the mutual benefit of improving healthcare for everybody. So please watch this space with this Global Solutions Initiative. I'm so excited about its future. And then how do you accept the Nursing Now Challenge? Well, I couldn't end without a bit of a plug to say, don't delay. If you're listening or if you support early career nurses and midwives, if you're part of that network, it's really simple to sign up. And once you've signed up, you'll have a whole new world that's open to you. So we've got a very simple process. about how you register, what your pledge is. We've got really good examples about how you can go about your challenge, what you can do. And therein, you're part of our family. You're part of this global network and this global support infrastructure that absolutely will try to be there for you for the good times and the not so good times. And furthermore, we really, really want to support you to identify and reach out to your employers, to represent and promote the Nursing Now Challenge at relevant events that you might attend. So I get, for example, on Wednesday, I'm speaking in Slovakia because one of the early career nurses and midwives is attending a conference and has said, oh, Lisa, would you be able to speak at this event? So there's real opportunities for us to spread the word across our fantastic networks that we have in all different ways. You can host a meeting and we can support you to do that. And we can also do some real deep thinking together. If there are particular topics that early career nurses in particular countries want to come together to think about, to engage in, to have some thought leadership, to have a bit of debate about what could change and how would we make that happen. So we haven't got lots of plans set in stone. That's absolutely not the way we work. We want to be responsive to the network, responsive to your needs, and we will only be as good as we are in listening to you, because we can't put ourselves in the shoes of an early career nurse and a midwife. I was one, but I'm not now, but we can learn from you and we can help to support you through that journey. So that's very much our pledge. This is not set in stone. There's a roadmap, but there's not a defined plan. So please, please feel free to influence it. And thank you so much as ever for your support. And we really hope that you will begin or continue your journey with us. And let's continue to see this global movement go from strength to strength. Thank you so very much. And I think, Alice, it's back over to you.
Yes, thank you, Lisa. That was fab. And I honestly still say this, and I say this, I think, every time I speak with you, Lisa, that I, to this day, am mind blown by how fast the Nightingale Challenge grew. And I'm super excited to see what comes next with this next chapter of the Nursing Now Challenge. And I think it's going to be great. So, and talking of sort of next steps and things, I'm going to hand over to Nick Bradshaw, who is the Director of Partnerships and Outreach at Wish, who is going to speak about some exciting upcoming events and collaborations. So over to you, Nick.
Thanks, Alice. Hello, hope you can hear me. My name's Nick, as was just said, and I work at Wish, which is the World Innovation Summit for Health. We're based in Doha, in Qatar, but with a global reach, and our ethos is basically collaborating to build a healthier world. So I think we fit in with this. Our showpiece event is a major conference every 2 years, but we work year-round on campaigns and research around healthcare. If we're honest, and I think we should be, Wish was rather late to recognise the important role nurses play as healthcare leaders. The Nursing Now campaign did put us on track, and since 2018, we've collaborated on a number of evidence-based reports and have worked together to provide leadership training for nurses, for example. Hopefully we've now caught up, and as an organisation, we're fully fledged nursing advocates. Certainly, we pledge to have nurses' voices heard in everything that we do. With this in mind, I'm delighted to do a plug, to draw your attention to an online event we're co-hosting with the Nursing Now Challenge team next Tuesday, 22nd of June, titled Nurses at the Forefront of Change, Challenging the Status Quo. So that's taking place from 2 p.m. till 5 p.m. London time, British summertime. And this event aims to delve into some interesting topics with a focus on the future of nursing. There'll be 3 lively discussions, and crucially, the event will also act as the springboard for the next 2 Nursing Now Challenge Global Solutions initiatives. I hope I've said that correctly, offering nurses the opportunity to think creatively about leading efforts to challenge pressing healthcare issues. Next week, after a short keynote from Elizabeth Ero, the Chief Nursing Officer at the World Health Organization, the first session will dive into the findings of a recent WISH report that explores the efforts needed to achieve global health equity, and specifically considers the important influence nurses have on promoting good health and access to healthcare in communities, and that's regardless of a person's age, their nationality, their gender, or their wealth. The authors of that report will be on hand to discuss its finding and the recommendations, and there'll be a chance to put questions to them. There'll also be a contribution by Professor Sir Michael Marmot, who's the director of the Institute of Health Equity in University College London, UCL, and he's the lead author of a report that came before our report on Doctors for Health Equity. Sir Michael acknowledges in his earlier report that doctors can only promote fair health outcomes if nurses are doing the same, and also recognises nurses' prime position as leaders in the global health ecosystem. And how that must be recognised. So we're expecting some informative talk from him. Next will be the two sessions, one on the role nurses can play in combating climate change, and then one that looks at the challenges and opportunities faced by nurses in an ever more digitised world. And these are the two where the Nursing Now challenges will really come into play. For each of these sessions, the lead author of two new papers, which are actually released by the BMJ on these topics tomorrow, they'll be quizzed by a panel of early career nurses, so we can expect some rigorous interrogations there. These two sessions around climate change and digital health will act as the launch, as I just said, of the two new Nursing Now challenges. These challenges will see nurses charged with coming up with innovative ways to ensure that nurses and midwives have a leading role in the way the challenges are dealt with within the healthcare world. And a winning nurse-led idea related to each topic will receive a prize from us, from Wish, of $1,000 and we'll also have the chance to showcase their idea, their system, their product at a future Wish event. So that's pretty much everything. The whole session will be moderated by Stephen Saka, the host of BBC World's Hard Talk. And to watch or take part in this joint Nursing Now Challenge and Wish event, taking place next Tuesday, 22nd of June, I think I've said it enough times now, go to wish.org.qa/events to sign up and to receive a reminder on the day. So that's it from me. Back to you.
Thank you, Nick. I'm actually really looking forward to that session. I'm one of the panelists, one of the young nurse panelists on it. So I think
Great.
it's going to be a...
Give the author a hard time.
I will. So I think that's going to be a fab session. And obviously I would say to everyone, sign up. I think it's going to be great. And thank you, and keep an eye out for all the new global initiatives that are coming, global solutions initiatives. I'm sure there'll be a lot more coming on what's coming next. So next off, I'm going to hand over to Pandora Hartman, who is the Chief Nursing and Midwifery Officer at JPIGO. Again, she's going to speak to us about collaborations with the Nursing Now Challenge.
Thank you for your kind introduction, Alice. And I'm delighted to be here with all of you today at a part of this amazing launch for the Nursing Now Challenge. Some of you out there may be wondering who JPIGO actually is. Well, I'm going to give you a quick kind of overview, the 1, 2, 3 of who we are. This is our mission. Our mission at JPIGO is saving lives, improving health, and transforming the future. We are a large international INGO that began long time ago, as I would say, in the 1970s, with a physician counterpart who saw the potential for cross-collaborative, cross-continental learning across the globe. And so he went in and put in the Johns Hopkins Program for International Development, and we've then gone on. It's kind of funny how we have grown and developed out of that. And I think this is a really exciting opportunity when we think of, again, the cross-collaborative effort with Coventry University, as well as we are a Johns Hopkins affiliate as well. So the world is wide open for all of us. This is our pledge to ensure that where a woman lives does not determine if she lives. We're all acutely aware of the interface between maternal and newborn mortality, although we've had great impact nurses and midwives and shifting things down, that we still have some challenges. And we know how much this impacts the overall health that nurses and midwives we do. Because if a woman passes on, well, we know the impact and the healthcare impact on the family. So although maternal child health is my particular favorite, particularly as a dual trained nurse and midwife, we can see here that's the expertise in all of these different technical areas where we have partnerships as well, including where we are together looking at the future of our nursing and midwifery workforce and really working to develop the capacity of everyone together. You can see here, this is where I'm super excited about our collaboration with Nursing Now Challenge, combining our networks. We have a huge network of offices with on staff. The bulk of our staff is actually nurses and midwives. So in all of these different countries, I have over 1,000 nurses and midwives in addition to other programmatic areas. So using your global network and our global network and all of the work that we're doing, particularly with councils and association and strengthening, because we know we need to replace ourselves. Those of us who have been doing this for 2 decades or whatever, we're not going to be able to do it for much longer. So just seeing the potential of this partnership together. And now we can add the Nursing Now logo to this great example of some of the partnerships that we do have in our global network of nurses and midwives all over the world. So we're still a work in progress. We're figuring out, and we're going to be coming to you for some more thoughts on what partnership could look like as we're looking at engaging and what webinars and showcasing what matched partnerships could look like with some of the existing Nursing Now groups in some of our country offices, looking at what mentoring looks like, not just at the early career, but at the mid-career, and how we continue to feed some of those who are even later career. What is leadership? We know this is a huge issue for everyone. How do we develop leadership? What does it look like across the continents? What are the lessons we can learn and things that we can share? We know that sharing is how we learn best from each other. And I think in doing this global networking with practice in the United States and then working globally, we've learned that we know more from each other than any research article could ever let us know. I just want to say thanks for this amazing opportunity to partner together and to develop our profession as we go forward to looking at the future. Thank you so much, and I look forward to interfacing with everyone.
Thank you for that, Pandora. That was great to hear what you're doing and all the steps that you're taking. And I think women's health, like you said, is super important. I think like everything else, but hearing what your work is and where you're doing it all, and I think it's going to be a great collaboration. I also just want to quickly take the chance to say hello to Dr. Sally Pizarro, who has joined us from Coventry University. She is going to be working with the Nursing Now Challenge and in their work and focus on midwifery. In 2022, she's going to be the midwifery champion and supporting the team with that. So it's really good to see that you're here joining us, Sally. Thank you for that, and look forward to seeing what is to come next there. So and up next on our agenda, I'm going to be handing over to one of our strategic partners, David Keane at the Health Education England. David is the Global Engagement and Education Lead. So over to you.
Hey, thanks, Alice. It's really great to be here, and I've really enjoyed those presentations so far. So hopefully you can all see my screen now. So my name's David. I'm Senior Lead for Education at the Global Health Partnerships Director at Health Education England. I'm a nurse by background, and now I work at Health Education England in more kind of policy roles. So I'm here to talk to you about a very exciting project called Talent Groups that we're setting up in conjunction with the Nursing Now campaign. And these are, so TALENT is an acronym, stands for Technically Assisted Learning and Education for Nursing and Midwifery Teams. I think as nurses, we all appreciate a good acronym, don't we? So good to get it in there. And then, so these are groups for nurses, early career nurses and midwives who have an interest in leadership development, bringing them together in virtual communities, which are coordinated and moderated by senior nurses or midwife leaders. We think that through online discussion, through looking at leadership theory, through sharing ideas, through getting peer support, raising issues and having a safe space to talk about problems, that the participants of the groups will be able to develop their leadership skills. So this slide gives a bit of detail about what each group will look like, really. So we're setting the groups up, we're starting with 5 countries this month, and then we're going to build on that over the next few months. So starting small, but building quite quickly as we learn our processes and what we need to get in place to run the group successfully. Each group will have 20 early career nurses or midwives. We think about 1 to 4 hours a week input from group participants. I think that will vary as the group progresses through its 12 months of support, and will depend on what the group's activities are and kind of what the conversations are going in. 3 senior nurse or midwife coordinators per group, and they'll be given support from Health Education England and Salford University, from the project team, in terms of how to facilitate and run a group to encourage leadership learning in this environment. We'll give some resources and some access to particularly to kind of leadership tools, and hopefully we'll encourage some sharing between the different groups as well. The groups will be self-directed. So what we don't want to do is dictate what the groups need to learn. So one of the first jobs of these groups when they come together is to decide for themselves what their year will look like and what trajectory of learning they need to take. But we'll help groups to make that decision, but that's to ensure that the learning that takes place is very context specific and relevant to all the nurses or midwives who are in that group. Most importantly, there'll be a safe space for professional conversations. So we've got, we're using THET's Pulse platform, which is not for profit and keeps everybody's data nice and safe. This picture is from Uganda, actually. It's from one of our pilot groups. And this was one of the pictures that one of the members of the group shared with her other group members, and showing her getting to deliver some inoculations and having to use a machete to get through undergrowth. So showing, real role modelling and demonstrating going the extra mile to deliver good patient care. So how do we think that we can support you to develop your leadership skills by using this learning process? So this slide, I could talk forever about leadership, but this slide just gives some real key pointers to help you kind of link up the concept of these virtual communities with leadership development. So leadership really is it's a set of skills and behaviours that we all have to practice and we all have to nurture over time. I always think it's more a craft than an innate ability. And there's lots of factors that contribute to good leaders. Some are in our control and some aren't in our control. Some are obvious, so they might be being given management responsibilities, seeing that you need to advocate for your patients at certain times, or coordinating and managing really complex patient groups. And for these kind of set of responsibilities, it's good to have a safe space to come and talk about what you're doing and what you might do differently. Then there's these less obvious skills, so these kind of soft skills that might include empathy and emotional intelligence that have been shown to be key to good leadership, and that developing self-awareness. So through reflective conversation, getting other people's opinions, you can really build those behaviours and build on the skills that you've already got. Finally, and I think these really define all of us as leaders, is how we react to things that are outside of our control. So that's the system around us might be stacked up against changes that we want to make. I'm sure we've all experienced that, or the behavior of others. So an underhanded comment, you know, from your team or from someone around you that can really undermine how you feel as a leader. So the idea is that a great space for you to bring your problems, discuss and compare that to what's going on elsewhere and the theory that's out there. So conscious of time, but I'm going to whiz through this slide. Starting at the top, I'm going to go clockwise, and this looks at some of the really identifies some of the skills that we think that group participants will get. And to a certain extent as well, if there's anyone out there who might think about being a coordinator or a moderator of the groups, most of these are relevant to people who would be the senior nurses who would be supporting the groups as well. So we start at the top with leadership skills, and there you're looking at new theories, looking at what's out there and being able to discuss and digest what you're learning. And then we've got better understanding your own leadership style. So doing exercises and coming to the group, listening to what other people are up to and how they're dealing with their problems. Getting real-time feedback on issues in your workplace, I think, is really key. And this idea that seeing a new perspective, listening to other people's perspectives and experiences really helps you build and find creative solutions to problems that you're facing. Developing critical inquiry and reflective skills, leading to having more empathy and emotional intelligence, as I say, absolutely key to being good leaders. At the bottom, sort of looking at networks, so connecting with other professionals who other motivated nurses who are looking to develop themselves in a similar way. Developing your social media skills, I think, something that that I'm certainly working on at the moment. And then supporting you to meet your CPD, so your continuing professional development requirements. Certainly in the UK, that fits around reflective practice. In other countries, there might be more of a framework of skills that are recognised by nursing associations, but that does need to be quite country context specific. And the last few are just being part of an innovative project. Really, we're going to have research that sits around this, and hopefully coming back to that picture at the beginning that we saw in our pilots, just by sharing your good practice, we can help you to empower and support each other. And then, of course, there's this global link, so the groups linking and connecting globally. So that's it for me, but thank you. This is all of our contact details for the project team. So there's email address there and various channels that you can follow us on. And then there's a list there of our key partners that are helping us to deliver the project. So thanks very much.
Thank you, David. That was really insightful and really exciting, looking at what's to come. Just a quick reminder for everyone that if you have any questions for David or any of our other panelists, please pop them in the Q&A box, and we will have time at the end for some questions. Again, like I said, for anyone, if they're for anyone on the board or just general about the Nursing Now Challenge, we can try our best to answer those at the end. So now I'm going to hand over to, again, one of our other strategic partners, Louise McGrath from FET. She's the Director of Programmes and is going to be talking about developing global partnerships and strengthening nursing and midwifery workforces.
Thank you very much, Alice, and it's a great pleasure to be with everyone today. I joined one of these events a few months ago, and it's just incredible to see and feel the really the passion and the commitment to driving this forward. So yeah, really pleased to be here. Yeah, let me just share my screen and show you. I'm sharing the wrong thing. This is me being a rookie presenter, as you can tell. Right, let me try again. Share screen. Right now, can everyone see that? Yeah? Fantastic. So as Alice said, I'm the Director of Programmes at THET. And just to give you a bit of an idea of what and who THET is. So THET is a UK non-governmental organisation that has a mission and vision to be strengthening the health workforce and the health system within which it operates. And our main focus is doing that in a number of lower and middle income countries, but also recognising that through the model that we use, which I'll come on to describe, there are benefits back to the UK health workforce, and obviously nurses being at the heart of that. So the way we achieve this is in three ways. Firstly, we have a country presence in 10 countries, and on the map in the top right-hand corner of your screen, you can see the countries where we're based. And through our presence in those 10 countries, we engage very actively with the ministries of health, with the key professional associations, including nursing and midwifery associations. And from that, identify where we can best contribute to addressing the key health system strengthening priorities. We also manage a number of grant programs. So we work with partners, funding partners, and then award funds to others to address health system strengthening priorities. And all of this work we do through a model called health partnerships, which I'll come on to describe in more detail. But this is partnerships between UK health institutions and health workers and their peer institutions in a range of low and middle income countries. And so the third pillar of our work is policy and advocacy, which is to enable us to facilitate this partnership working and to contribute to health system strengthening through adding additional value on top of the work we're doing on the ground. So just to give you a sense of the breadth and depth of some of the partnerships that we've supported on top of our own country presence, the bigger map at the bottom of the screen shows you some of the partnerships that we've supported and where they've been working. And some of the figures on the right of that screen give you a sense of the number of health workers trained. I'm not sure whether you can see the figures, but over 93,000 health workers trained. By that stage, that number has increased since these figures were pulled together. But this is working in over 30 countries on numerous health themes and with various cadres, but nursing and midwifery being the most significant cadre of health worker that we work with. And that's both in terms of the UK health workers engaging in the programme and also those that are engaging on the lower middle income countryside. So that's just giving you a quick overview of the main focus of THET. In terms of health partnerships, just to go into a little bit more detail what I mean by this model, because it's quite a unique model that THET has. And this is these partnerships, which tend to be long-term. They're not just for a particular project or piece of work. They're normally long-term relationships between institutions that where people come together to identify how they can best support each other to strengthen the health workforce. And in most cases, the partners will co-develop, i.e. work together to develop a response to a particular priority, and then work over time to deliver that project to address that priority. The projects and the work we undertake is normally volunteer-led. So the people who engage in our projects are normally working as volunteers, whilst recognising that some paid staff are required to deliver projects as well. So it's not purely a volunteer model. But a key point which is highlighted there is that these are mutually beneficial. We recognise that this isn't a one-way set of do-gooders doing some good in a particular country. It's very much everyone benefits from being part of these partnerships. Different benefits from are gained on both sides, but in most cases we see that equal benefits are gained. There's a very strong focus on multidisciplinary team working. So whilst we work with specific cadres, and I say nursing and midwifery being the core, we recognise the benefit of multidisciplinary team working. And it's a model that's very strongly and supported and endorsed by key institutions. So the WHO is very supportive of our model, as has been the UK government and European partners. So we're part of something called the ESTER Alliance, which is a body of other organisations that work through the similar model spread across Europe. And all of our work is underpinned by what we call principles of partnerships, the POPs as we like to call them, which are quality standards associated with this work that really try and ensure that the work we do and that our partners do really has aid effectiveness at the core of what we're trying to achieve. And the types of organisations and institutions typically involved in health partnerships are things like hospital trusts, professional associations, regulatory bodies in some cases, universities, training colleges, etc. And this is just a bit of a snapshot of the range of institutions and sorts of bodies that THET is at the heart of convening relationships between. So that's just a really quick snapshot. But in terms of the specifics of the work we're doing, particularly with the Nursing Now Challenge, there are a number of really exciting projects that we're involved in. So the project that David described just now, THET is really pleased to be part of that initiative, and we're playing the role of facilitating the in-country relationships and ensuring that that perspective and relevance is applied to the shape and the work of those communities of practice that are being established, those learning groups that are being established. And we're also facilitating linkages with key nursing institutions and bodies in each country to ensure that the right people are aware of the programme and can engage with it, and also that early career nurses can be made aware of this opportunity to engage. We are also very pleased to be starting a new project, which is just starting this month, funded by the Burdett Trust as well, whereby we will be providing specific leadership and quality improvement training and support to nurses and midwives. It will certainly very much accompany the initiative that David described. It will be an extra initiative that will run alongside and work with additional sets of nurses and midwives. So this initiative is a fellowship program, and it was originally designed to run alongside a big funding program that we were running. Unfortunately, due to the recent UK aid cuts that the UK government has been applying, that program has now been cancelled. So we're currently in the process of redesigning the way we'll deliver that fellowship program. But it will be a program that we'll be putting out a call for nurses and midwives to apply to be part of this training initiative. And we will have some focused leadership and governance training, as well as some quality improvement training, and there'll be small bursaries to implement quality improvement initiatives in institutions between nursing partners. So the details of that are still being worked through, but we hope to be able to share details in the coming weeks and months with those interested. We are building our nursing leadership within the organisation, so I'm very, very pleased that within our existing team we've been able to identify Noura Aidid Ibrahim, who I think is on the call. Noura, are you with us? Just to quickly introduce yourself whilst we're here, because Noura will be playing the lead role in these two nursing initiatives. Noura is herself a nursing leader and educator. Noura, are you on there? Can you? I'm not sure that Noura is able to connect, or but we'll come back to Noura later if she's able to say hello. So Noura will be at the fore of this work, and we felt that was really important. Noura is our country director as well for our Somaliland programme. So I think brings really strong understanding and perspective of nursing leadership in an African context. We have also, as David mentioned, got the Pulse platform, which is an online platform which really facilitates engagement between health workers, and as David mentioned, that will be used for the talent program. And we are also wanting to encourage other people to sign up to the platform, and the link is there, and we'll share it in the chat after this session, whereby you can come together with other nurses and midwives interested in sharing learning, looking at ways of connecting. So yeah, we'll really encourage that, for you all to join that as you can. Noura, did I hear you coming online there? I heard some.
Yes.
Just to say hello if you can.
Hello, everybody. It's my pleasure to be here today and say hello to everyone. My name is Noura Aidid from Somaliland. I'm currently working with a number of nursing initiatives, especially THET, and supporting different countries. And we are currently working with Health Education England, as David explained, supporting different countries and coordinating those initiatives. I hope today a number of nursing associations joined this webinar, especially Ethiopia, Somaliland, and Zambia. And yeah, it's a pleasure me to say hello to everyone. Thank you, Louise.
Thank you very much, Noura. Good to hear your voice on the call. And just to clarify, Noura mentioned those particular countries, because in the first wave of countries for the talent program, the program that David was talking about, the first countries that will be working to support, engage in this program are Nepal, Ethiopia, Zambia, and Somalia and Somaliland. But other countries will be added after this first wave. I think that's the end of my presentation. So yeah, thank you very much. It's been a real pleasure to be able to share some of these details, and we'll very much look forward to engaging with a number of you as these programs are rolled out. Thank you.
Thank you so much for that, Louise, and thank you, Noura, for popping on just to say hi. It was an absolute pleasure. So one of our last sessions before we move on to a Q&A from all of you that have joined is we're going to be moving on to the fabulous Maureen Bisignano is going to be hosting a Q&A session with Monica Lanchi. Maureen is one of our board members for the Nursing Now Challenge and was a board member for Nursing Now as well. And Monica is it leads one of the Nightingale and Nursing Now Challenge programs over in the States. So I'm going to pass over to you two if that's okay now. Oh, Maureen, we can't hear you.
Okay, I think just hearing me to go ahead and start. I'm just going to do a quick introduction and share how I became a nurse. So my name again is Monica Lemche. I'm a program manager for Indiana University Health System Nursing Team. And I led the Nightingale Challenge program in our facilities or in our system. And I continue to lead that program for our organization. So I first became a nurse because I was told to. So my story is a little bit different from most. I was born in Cameroon, West Central Africa, and I moved to the United States in August of 2020, or 2000, not 2020, my goodness, 2000. And when I came to the United States, I wanted to be a biochemist. And I thought it was just the coolest thing to do. And incidentally, my mom is a nurse, now retired. My sister is a nurse. So my sister said, how about nursing? Let's do nursing. And then when you're done with nursing, you can do whatever you want after that. And I did it because I was told and she was paying for it, but I just ended up loving it. And it's become the most rewarding career that I could have ever imagined for myself. So nursing for me was not going in yet to take care of patients, but going in because I was told to. But once I got in that, I just love the patient care. I love being able to provide and support my patients. And I've continued to grow in the career to see the different aspects of what nursing could provide. And now here I sit leading a program that is empowering and training and supporting nurses to be leaders at the bedside. So I wanted to start there, and then I'm going to see if Maureen is able to connect with us now.
Can you hear me at all? Oh, great. Always some technology. Well, welcome. And Monica is, I'm so glad that you could start with your story. I feel so passionately about the challenge because I was also a young nurse and doula. And in my early days, I found that I saw things quite differently than the leaders in my health system. But I found that it was really difficult and challenging to get them to listen to what I was seeing and what I hope to do. But gradually I found that I could find my voice and made some dramatic improvements in care models and in our doula, our maternity area. And that gave me courage to apply and then be appointed as the CEO of a hospital when I was 34. And I found that I had a very different voice as a CEO in the United States than all the others. But that pretty soon people started to ask me questions and listen, because the skills and the assets, everything that you talked about in the prior sessions really does help to make things stronger. So I feel very passionately that building leadership skills and getting the voices of nurses heard globally is a critical way that we can make healthcare better. Some years later, Dawn Berwick and I founded the Institute for Healthcare Improvement, and our mission is to improve health and healthcare worldwide. And we can't do that. I loved, Pandora, your quote, sharing is how we learn, because that's what this is all about. The whole Nightingale Challenge and the whole of Nursing Now is sharing. So Monica, back to you. So tell me, how did you begin to get involved with the Nightingale Challenge, and how did you begin to design it?
Right. So I joined our system nursing team in October of 2019, and one of my first projects was, here's the Nightingale Challenge, go ahead and implement it. So in a couple of months to kick it off in January, I really thought through what was it that we were seeing, and I reflected on my practice as a nurse. Starting out as a new grad, there was never an expectation that I should be a leader. So coming out of nursing school, I wanted to gain my clinical skills and start saving lives. And the first year of nursing was struggling to not feel the patient, right? To know, what am I doing? What did I sign up for? But as I continued to work as a bedside nurse, I found that I needed to have some of those, what David called those not so obvious skills. I needed to be a leader. I needed to have some emotional intelligence, self-awareness. So that struggle in trying to figure out how to really lead at the bedside existed for the majority of my time at the bedside. And when I got into a leadership role later and had that expectation that I needed to be a leader as well as manage the business, I had to grow those skills. I had to learn all those different leadership skills. And with that, I had a thirst for being in further leadership roles, went back to school and came back to the bedside, and things became easier this time around. I found that, oh my goodness, I was having better conversations. I was emotionally intelligent. I could even receive feedback more effectively and all those things. I was very self-aware. I could speak to my values as a nurse, what I brought to the profession, why it was important for me to be agile, to embrace the ambiguity of our profession, because there are times when we wouldn't have all the resources. And so through that reflection, I found if only I had those skills when I was at the bedside, the first so many years in nursing. What a remarkable first 8 years before I took the leadership role of what I have had. And so looking through that lens and looking at what was happening in the environment, and our nurses really struggling with those, again, soft type skills and embracing their profession, I started looking at the program in terms of what is the great message? What is the theme? What is something that I could really underpin the program and help elevate our nurses and awaken that knowledge that you are a leader? And so I settled on lead regardless of role. I really wanted to let our nurses see that nursing is leading. And I think somewhere in academia, in practice, we have decoupled that. We have made our profession seem like something other than that, where we're uniquely positioned every day to lead. We're called upon, regardless. We're closest to our patient. We have to be the innovators, right? How do you do that? How do you see those things like Maureen said? I see things differently, but how do I start articulating that? How do I put that in an executive summary type thing so I can bring to the decision makers? How do I embrace change? How do I look at change like a necessary thing for patient care? How do I look at the nursing process and connect to all these things that I'm doing in the nursing process is the same way that I can approach the different things that we face in healthcare. So thinking through that helped me sort of settle around leadership behaviors and building the programs through 4 core activities. First, that foundational information on here's what we're talking about, here's what self-awareness means, here's what emotional intelligence means. And then monthly articles, then I supplemented the information by sending out monthly articles that really help highlight certain aspects of it. And then also reflection. As people, as leaders, as nurses, we always have to reflect. So I threaded ways for them to then sit and reflect throughout that program. So once we launched and built the curriculum, it was quite an amazing experience to see the nurses coming through it and learning through it. So more interesting outcomes as we went through that program. So very fulfilling.
And Monica, what I love is that you created a passport. You said, this is a journey. And so Monica created a passport, just like a passport book that says there are things that you can do on your journey and you can decide that journey. And you've got now 200 nurses. Tell us a little bit about how that's going.
It's been fantastic. So the outcomes, we started again in January of 2020. We had all things ready and the pandemic happened. So we had to pause. And when we paused, I had a lot of nurses say, no, I want to continue to do this. I really find the content value added and applicable to my role. But we picked it back up in June and continued with the program. And out of the nurses that stayed with it, and we tried to accommodate everyone. We knew that with COVID and work-life balance and different priorities, everybody cannot meet all the program objectives. But at the end, we had 97% of our nurses who had what we call an individualized development plan. Because it was key for me to highlight that being a nurse and a professional nurse, you need sort of an idea of where you want to go. And that is an iterative plan. So it's not set in stone. So they figured that they looked at what are my resources. If I want to be an expert nurse where I am, here are the resources, then here's how we support you. 41% more in accepted leadership roles. That was amazing because we never highlighted a leadership role. What I did was really remove a title from leadership and really focus on leader behaviors. But they said they had the confidence, they were motivated, they were encouraged, they now have resources and tools, they have ways to articulate, and they started building those innate and maybe dormant traits that they had. And a lot of them went back to school. A lot of them had specialty certifications, really to cement that, you know, in my practice area, I am this competentness. And so with those results, we said, you know, we have to continue on beyond 2020. We really have to give our nurses the time and space dedicated for them to really grow professionally and succeed at the bedside.
So time, space, connections, opportunities, and a pathway. What was the biggest surprise that you had, Monica, when you launched the challenge?
I think there were a couple. The first was really that awareness. Although I felt within myself that we did not connect nursing to leadership, but when I polled, I had in the first kickoff ceremony, I had 121 nurses, and I polled them regarding what are the characteristics of a nurse, and then what are the characteristics of a leader. And I said, with this leader characteristic, is there any leader characteristic you would not ascribe to a nurse? And none. You know, prior to that, I actually asked them, how many of you can confidently say you're leaders? And I had two hands go up, and that was a manager and a nursing professional, practitioner, and educator. But the rest did not connect that. And I said, when you look at those leader characteristics that you put on, that is nursing. That's what we do. So it was an aha moment. And it was really the catalyst that got them thinking about, you know what, I'm a leader and I need to gain those skills to be successful. The other thing that I saw missing in our profession is we have a gap in our literature around leading as a behavior in nursing. So trying to get source materials for them, for our nurses to really look at leadership broadly. Everything that we have is around a manager, a director, your emerging leaders. So we need some space, and a lot of what David and the rest are doing in terms of leading and the Nursing Now, a challenge, will highlight that and bring that forward to see, you know, what is it that the nurses can get from that. So those were two that really stood out to me. And the third and most important was the thirst. There is an appetite, a huge appetite for this. Sorry, I missed that.
So I totally agree. I think once people put it out there as a real part of the healthcare system, leadership, I think people do really, and your idea about making a passport, I think was brilliant, because it told people wherever you are today, just jump in and we'll help you to move to a different place. And I really, really loved that. How do you see yourself, Monica, leading this going forward?
I have engaged some of our Nightingale Challenge nurses to really call them our NC nurses to help iterate the program, you know, reflecting back on what worked, what didn't work. But I think I really want to have the local. So my system is across the state of Indiana. So I needed some local leads to help support the program locally and champion it. It's really circling back with that group and the NC nurses and say what worked for you. because we want it to be intentional. We want it to really speak to their day-to-day work. So I'm focused on developing a curriculum that will give them that space to where they can take the content, it's easily digestible and applicable. What we see a lot of times is we give a lot of abstract content, and then our nurses take it and they don't know what to do with that. But giving them content that they can take it and apply it same day, it gets that pull. So my hope is as we continue to provide this program, there's more of a pull than a push where nurses are talking about it and nurses are warning you because they're seeing it in practice. They're seeing their nurses, their peers change and how they're able to be more agile and adaptive to within your environment. So I hope that that's the kind of program that we settle with, and I'll leverage a lot of what I'm hearing today to continue to build it.
Thank you so much, Monica. And we do have so much to learn from your experience, and we can share some of the research that Monica's been doing to find out the number of people that enroll, the number of people that are engaged, and what kind of pathways they are developing for themselves. It's so important. I think one of our primary goals in Nursing Now is really to get more nurses into roles of leadership across the healthcare systems, governmental positions, boards of trustees, so that our voice and our perspective, which is so important if we're going to make health and healthcare better worldwide, is seen and heard and valued. So thank you. What you have done, the passport is brilliant. Thank you for what you're going to do. And Alice, I'll turn it back over to you.
Thank you so much, both of you. That was so interesting to hear your story with the Nightingale Challenge and moving on into the Nursing Now Challenge. Also, Monica, I just saw that there was a question for you in the Q&A box just before you sign off. It was just someone asked, what master's degree did you do when you went back to school after bedside nursing?
I went for master's in healthcare administration because I wanted to get a more global aspect of nursing, because I felt like my associate degree, my bachelor's degree had prepped me set up with nursing, and I wanted to get a bigger, broader healthcare environment experience. So that's my master's.
Thank you. Thank you. It's interesting to know. I'm one of those people I like to know, and I think a lot of other young nurses like to know that sort of how people got to where they are. And I think that's something that's really good about this, is having nurses that are further on in their career being able to pass that on to us, of saying it's not a straight road, it is. And I think that's something that sometimes we're not prepared for, and it is great to have these communities that we can speak to and understand that there is ways to get to where we want to be, and there's people there that'll help us along the way. Thank you for that, Monica. And Maureen, it's always a pleasure to hear you talk. But finally, we have some time for some questions for the panelists. If anyone wants to pop any more questions into the chat box or the Q&A box, please do so. But one that has come up is that now obviously the challenge is open to student nurses, and it is just how they would go about getting involved. Does it have to be through the universities and things like that? I don't know if Lisa or someone maybe wants to answer that one.
Yes. Well, maybe while Lisa's coming on, I'll just add that at the Institute for Healthcare Improvement, we've made some courses free for all nurses around the world on quality improvement, on innovation, and on leadership. And so I would encourage you to go onto the ihi.org website and take some of those courses, because that gives you the tools to begin to launch or to run an improvement project. And when we can make results better, I think that gives nurses visibility.
Brilliant. Thank you, Alice. Thanks, Maureen, for that. And as ever, always inspirational to hear you and your journey so far. On the issue of student nurses, we're delighted to say that we are now open to student nurses. And actually, Maureen, as one of our board members, was right behind us with this initiative. There's information available on our website for you to see how to do it. But it's really important that you get sponsored and supported by your education institution, just like with the Nightingale Challenge participants and now the Nursing Now Challenge participants. We need you to be sponsored by your employer or by the person that's actually supporting you to develop as a fantastic nurse. So I hope that's helpful, but there's more information on the website, and happy to take an offline conversation if needed too. Thank you.
Thank you, Lisa. And I think that is something that I know personally I'm really excited about. I think it is great that students can now more formally get involved. I know there was students that got involved with a few things, but if there are any more questions, please pop them in the chat box, or feel free to add them in the Q&A. If not, I'm more than happy to, let's see what there is. So here's a question, and it's open to the floor of all of you. I think some of you might be able to question this, is where to start when influencing key decision makers to hear the priorities that we feel in nursing. Does anyone want to take that question? It's quite a big one, but if anyone wants to take it.
Well, I'll start. And then I think getting heard is a critical question. I love this question because it is a challenge for all of us. And what I found in my early days was sometimes because I was a nurse, it was harder for me to be heard. So I developed a method for getting across to people, and it seems to work. The first thing is I would tell a patient story. And some people in the room, whether they were leaders or regulators or policymakers, would relate to that story and how we could make things better for this particular patient or family. But then at the end of the story, I would extrapolate to the total population and say it wasn't just John. There are 380 other people just like John in our system today. And that gets the people who have more system responsibility. And then I would share the human cost, because so few people actually see the journey of a patient across a year or a month or a complicated care system. And then I would tell the financial cost. And that arc of story, extrapolation, human cost to financial cost really seems to get everybody in the room. So you might try that.
Thank you, Maureen.
Simpler.
Is anyone else wanting to add anything to that?
Could I just make a suggestion, Alice? I don't know if Nick is still with us, Nick Bradshaw from Wish, but from the perspective of a non-nurse, actually, that works in healthcare, Nick, I wonder if you've got any top tips for our audience as to how we might get our voices heard, or what actually would make you listen, I guess. I mean, we have made you listen because we've got a fantastic work with you, and we love to work with you, but really keen to hear your thoughts.
That's the key thing. You really have made us listen. And I mean, great tip there from Maureen about telling the human side of things, which, let's face it, nobody has a better viewpoint of the patients than the nurses do. I mean, in terms of being frontline and then extrapolating that and making it wider. I think as soon as you put a nurse in front of an audience and start speaking, people have to listen, because I think it's a voice that for so long hasn't been given the due respect it deserves. So when you hear it as a non-nurse, it's like something clicks. It says, well, of course the nurses were the people to listen to. Of course nurses are leaders. It makes no sense for them not to be. So all I'd really say is have confidence in your stories, in your expertise, in your professionalism, in your abilities, because they are so strong that they're very, very hard to ignore.
Perfect. Thank you. Sorry about that, Alice. I just was keen to hear Nick's view. Fantastic.
Louise, on you go.
Just to come from a different angle, it's also worth thinking about who are the people who can affect change, and therefore who should you try and influence. So it's also worth thinking about, it hasn't always got to be the key decision maker that you might reach out to. It might be other people that can influence that person. So it's worth thinking through who might have some influence over the decision makers, and might it be easier to access them rather than the top decision maker. It's often thinking of those routes to influence that can be helpful and more manageable, particularly in the first instance. Thank you.
Definitely, Louise. Kind of 6 degrees of separation is kind of how I look at it. So many times they laugh because I always talk about looking past the perineum, right? Look beyond what's absolutely in front of you. So as nurses and midwives, looking kind of, okay, well, who's around that person? What are some of the non-traditional venues to influence as well? Because a lot of times we're speaking to the converted already. So, is it just that getting your voice heard? Look at the newspapers. What newspaper articles are being printed, positive or negative? Somebody needs to respond back to that, because you can see. So, recognizing that influence is not just top level, but everybody's steady chipping away at it and influencing this one and influencing that one. Your neighbor's cousin's brother's first sister, auntie down the street, does have an impact on what is going on, and make the assumption that nobody knows. Never forget your officers as well, right? Your elected officials. Send them the information. Anytime they hear from a constituent, they get a wee bit concerned, right? So make your voice heard. Tap into your national associations. They've got standard packages. Use it. Start getting some of the form letters out. Things like that, I find, tend to make a huge difference, and getting new allies.
Thank you, Monica. Are you wanting to add into that?
Yes, I was going to add that for me with the Nightingale Challenge nurses, one of the things I highlighted was to give them that confidence and help them collect their thought is the S bar. I don't know how global this is spread, how we communicate as nurses. We talk about how you communicate to your physicians. You start with S being the situation. You talk about the background of what is going on with your patient. You do the assessment. I've done my assessment. This is what's happening and my recommendation. So I have them look at an S bar like something that you use, one of your really great communication tools. If you have a thought, put it down, put it in an S bar, and then if you're pulling in anecdotes or you have data to support it. So everything Maureen said and everybody has said, just draft it in an S bar. It helps you be concise, helps you rethink through your message. So when you go to your leaders, you have that. You can really clearly start with your situation. And that can be turned into a great executive summary if you need to submit it. So that's one tool that I recommend using.
Thank you so much, all of you, for that. That was actually really insightful for me as well. So that is the end of the questions that we have at the moment. So I just want to say thank you to all our panelists that joined us today. I always come off of these webinars feeling very inspired to go out and make change, and I think that's what they're here for. So I want to say thank you to you all. If anyone who has joined us today has any more questions or queries, please do not hesitate to get in touch. A lot of things you can find on the Nursing Now Challenge website, or if you go, I've got it here, it's info@nursingnow.global. For anything, and someone should be able to try and answer any questions that you've got. Again, remember, please sign up to the WISH event on the 22nd of June, which is next week, our webinar, which will be very exciting. There will be lots more information coming about that. And again, thank you all for joining, and hopefully see you all again soon.
Thank you, Alice, for leading.
Thank you.
Thank you.